Welcome back, Jose with Hair Transplants of Florida again. Today we're going to be talking about FUE versus FUT. This is a very hot topic in the hair restoration industry. Probably not going to be able to cover everything about it, obviously, in a short video. So if you have any questions, call us, email us. I'll be happy to share more in-depth information about both. The FUE, follicular unit extraction method, a lot of folks think it's the latest method. It's actually the oldest. 30 years ago, hair transplant results weren't very natural looking, because they used to come back to the donor area and punch out groupings of 15, 20 hair. They used to transplant in between what a patient still had, and when it grew out, it looked pretty decent. The bad thing is if the patient kept losing more of their native hair and the only things that were left were the bunches of 15, 20 hair, well, it looked like doll hair and it looked very unnatural. And nowadays you're better off not doing hair restoration if that's what the result is going to be. But today methods have improved. FUE equipment has improved. Today we can harvest one by one the way our hair naturally grows, which is groupings of 1, 2, 3s, and 4s. And then we transplant the ones in the front into groupings as we go back to give you density. So we can definitely mimic Mother Nature today. The FUE method is an excellent method for patients that plan to have their hair really short throughout, especially in the donor area. Let's say military career folks or police officers, that don't want to give up their really tight hairstyle. The FUE is a good method because it leaves dot scars instead of a linear scar, which is what the FUT does. The dot scars, once the hair starts growing a little bit, the dot scars become fuzzy and you can't really see them. So it's definitely beneficial for those patients that want to maintain their tight hairstyle. Also, you don't have sutures involved with the FUE procedure. Those little dot scars, they seal up by themselves. So probably take still about a week to heal, but nevertheless you don't have to come back for suture removals. The FUT strip, you probably get a higher yield because we're separating the follicles to their natural state, to the 1, 2, 3s, and 4s under high-powered microscopes, so we don't cut into them. The FUE is something we call the blind harvest. We don't see the follicle under the skin, so we guide ourselves by the direction of the hair. And as great as Dr. Gallagher is and our team, we do have a percentage of loss, whereas the FUT, because we're separating under high-powered microscopes, we can see the follicle and we don't cut into them. So you do have a little bit higher yield with the FUT, the strip. It is more affordable, the strip is, than the FUE. Since the FUE is more time consuming because one by one we're harvesting, it does cost a little bit more. I'd say about 30 to 40% more even, depending on how many grafts a patient does. The strip is still pretty much the golden standard in the industry, even though we do a lot of FUE cases as well. One thing we do mention during consultation, FUE, for patients that have very aggressive hair loss patterns, the FUE can begin to be a little bit of a problem, because if the patient's going to need more than one procedure and we harvest their donor and you have too many dot scars between dot scars, this donor area can now begin to look diffused while we're trying to give the patient density from front to back. So for multiple surgery patients, the strip method, the FUT, can be the better option. A lot of companies that are selling FUE machines out there, they promote the FUT as terrible scarring and they show you terrible pictures. If you have a board certified surgeon that's performing your procedure, whether it's FUE or FUT, you're going to have a great result, and your donors going to be taken care of the way it should. For the FUT, Dr. Gallagher performs something called a trichophytic closure, where basically he overlaps one end to the other and hair grows through the fine line. And basically you can we have patients that leave their hair as short as a number 2 clipper and you still can't see the fine line. So definitely you'll be in good hands if you choose Dr. Gallagher, whether you have the FUE or the FUT. Biggest recommendation, find an office that offers both. A lot of non-specialists only offer the FUE because they have a technician doing the whole surgery while the doctor's doing another surgery. don't recommend those offices because your doctor should be performing with your surgery with the assistance of technicians, not the other way around. So try to find an office that offers both. We offer both the FUE and the FUT. We're not the only office in Florida or in the nation, obviously, that offers that, because you're going to be explained both options correctly without any special interest behind it. We offer both. But we sometimes recommend one over the other depending on the factors involved with a particular patient. So if you have any other questions about FUE versus FUT or any other topics related to hair restoration, you can reach us at 855-855-4310, or you can check out our website at www.hairtransplantsoflorida.com. We'll talk to you soon.